Welcome to Recovery, the Whole Enchilada, a podcast dedicated to exploring the many layers of healing and growth within our recovery community. I'm your host, Peg McDermott, along with my co-host. Hello.
Oh my gosh. Well, hello. This is Heather Hagaman tuning in.
And together, we share conversations that honor the complete recovery experience. And today's conversation is about dual recovery. And I guess that can mean several things to many people, but basically the way we're approaching it in our discussion today is living with both a substance abuse disorder like alcoholism and a mental health condition like depression or bipolar or PTSD or the many other ailments that we all have had to deal with at one time or another. And it's a big deal in our community and in the rooms. I went to a conference this weekend that's part of our community, the structure of our program. And one of the discussion points was updating some literature around medication in the rooms and how medication is used. And that included pain medication, medical marijuana, and other substances that were not in existence when the initial literature had been written. And most everyone, and there were 300 or 400 people there, the discussion was lively, and it was primarily around bringing that up to date because how our lifestyle and things have changed over the years. They're not the same. And it's important that we at least acknowledge it and be able to share some literature for those that are new or still confused around their own dual recovery. And how is that handled? How is that managed? We're not therapists, so I want to definitely emphasize that. We're not advocating one position over the other, but I think it's a great topic for us to talk about, and hopefully you will be able to get some nuggets out of it that you think will help and clarify perhaps some confusion around this, because I know I was confused for a long time around it, especially around pain meds. And I know of folks that won't take them at all and those that will take them as prescribed, right? Because pain medication was made for a reason, to help us manage physical pain. And when I had my knee surgeries, I had to take pain medication, and I was definitely open about it with my community and my network and my mentor. Let them know this is what I was prescribed. This is how I'm supposed to take it. This is who is going to help me take it, because I had someone there who would give it to me at the intervals that were needed. And that was, for me, a safe process around what can be a slippery slope. What do you think?
This is a really important conversation, and I'm really grateful that for the work that you do, that you went and did this, and now you're bringing this back and sharing this. I'd like to keep it simple. I just feel like two things to normalize here: that medication is often a part of dual recovery treatment, and that treating both conditions together is more effective than just treating one alone. Can we say that? That's pretty much it.
Yeah.
And what I think happens to some of us, and I will speak for myself, when I stopped using my strategy of alcohol to deal with what I really did not think I had a lot of, but I certainly had enough to use it to deal with it. But once I stopped drinking, I certainly felt a tremendous amount of anxiety, which led me to insomnia and panic attacks. And I struggled with that. And I think I came in thinking back in those days, 25 years ago, that I should try to do this on my own. I just should try to manage this. And I think I just went over to other strategies that weren't helpful For my anxiety, you would eat a lot of sugar, which is funny because you would think sugar would make you more anxious, but somehow it made me more calm. Or big meal, eat more to make me feel more calm. If you think about eating is a kind of a way of earthing yourself, of grounding yourself, because you're grounding yourself with food, right?
Right.
And then the sleep issues were just were horrible. And I started going, a lot of people were saying you should go to doctors to try to get help for that. So I went to many different doctors because I had many different symptoms. I would have to go to the bathroom all night long. And so I went to a kidney specialist. I mean, there were so many different things. But when it really came down to is what I had was complex PTSD. And that's what I was treating all those years of drinking and drugging.
Mm-hmm.
And so what do we do for PTSD? And there's not a whole heck of a lot. They basically just treat the symptoms. There's not one thing that really helps with post-traumatic stress injuries, especially injuries that occurred as a child and altered your nervous system and changed the way your brain is. And so I worked with a doctor for sleep, and I went on medication and tried different types of medication and finally found one that they said wasn't addictive. They really touted that it was going to be safe, and it actually turned out to be extremely addictive some years later, and it took me quite a long time to get off of it. But I do want to say, as I went along trying to get sleep as a priority, my anxiety was pretty difficult during the day. And I was just always up and down. And I finally had a therapist number. She said, you really owe it to yourself, especially since I was moving into menopause. And I'm just going to say that offers a whole nother bunch of things going on, right? So she was like, and she used that, you're going into your perimenopause, you're going into menopause, you might want to consider medication for your anxiety. And so after 5 years of white knuckling it and being in constant state of anxiousness, I finally worked with a psychiatrist. You see, a lot of us want to go to our general practitioner. That's not who we work with. We need to go to a psychiatrist.
Right.
And I worked with a psychiatrist who put together a way of me taking, and had to go through many different ones, but I finally found one that did work, and I stayed on it for some period of time. And what it did, and I just think it's very important that you hear this, is it just made me feel, if there was a word to say other than normal, it just normalized me. I didn't have the ups and downs. And even though it kind of felt flatlined in a way, that felt better than what I had been going through. And so I was able to stay in that flatline place for a while, felt like a lower affect, and it felt okay. But eventually I wanted to move away from that, and that was fine, and the time was right. But I just want to say that I was one of those people that took a lot of convincing, and I'm really grateful I did that. I wish I had done it earlier because I was so miserable for some years in early recovery. And I think a lot of people could go back out because it's so painful.
Yeah. And I think many do.
Yes.
Because the stigma around it. And the fact is that many of our folks in our community do come with other issues. I came in with depression and ADHD, impulse control and stuff like that. And I didn't get on antidepressants for quite a while into my sobriety. And my therapist at the time said, I think you're depressed. I think you have chronic depression. So it's just sort of this low-lying, underlying sort of malaise and just feeling a melancholy. And she recommended that I talk to my doctor about it and get on an antidepressant, and I did, and it really made a world of difference for me. It didn't alter my mood. What it did is it helped to regulate the chemical imbalances in my brain that caused the depression. But it didn't get me high or anything like that. It was just more stabilizing those chemicals within me that I think I was born with, or at least became in a difficult upbringing, it became a coping mechanism for me to just shut down. And, it's a whole freaking new world opened up for me when I got on those antidepressants. And again, this was for me. This was my path. I'm not advocating it one way or the other, but it worked for me. And I think had I not addressed it and talked to a therapist about it, and then finally get prescribed what was at the time an antidepressant, it may have taken me out. It was like, what's the point if I'm going to be miserable all the time? I might as well drink, right? And I didn't want to, because I knew if I did that, I was going to die. And that is why I said this is something that I need to get outside help for and talk about, and get the kind of medication that is safe to take, taken as prescribed for me, and helped to normalize or equalize or balance those chemicals that cause the depression. And also just my own upbringing and the beliefs that I formed around that upbringing and the things that I told myself. So the combination of my recovery and my therapy and the medication really helped me to connect a lot of dots and look at the world through a clear and sane lens. And it's important to talk about this in our world, because a lot of the times it's not discussed. And if you have got to go to a treatment center for this issue, they say get sober first. And if you go to see a mental health professional, they say get stable first. And people fall through the gap. And we need to look at this as a real challenge at times within our rooms. And there are some that are huge advocates against taking any kind of medication. I'm not one of those folks. I think that medication has its place as long as it's prescribed by a doctor and managed by a doctor and taken as prescribed. If it's abused, that's a whole other story. It's a whole other issue. When we're dealing, and many of us, I think, do deal with these dual recovery issues, whether it's anxiety or PTSD or trauma, traumatic issues that we're still working through, depression, ADHD, bipolar. There's lots of challenges, eating disorders, other things that we have to, I think, be realistic about in our rooms that actually do exist. And we need help around that. For me, did I drink because I was depressed, or did I get depressed because I drank? I don't know. I think I drank because I was depressed. I am not depressed now. I have no intention of drinking, because guess what? If that happened, I would get depressed again, because it's a depressant. And alcohol is a drug. I mean, make no mistake. I didn't do traditional drugs. I made a mess of myself with one drug called alcohol. And I think that the medication question is one that's it's a charged topic at times. There's a lot of discussion around legal marijuana and when that's prescribed, why it's been prescribed, what's the motivation behind using it? Is it for pain management? Sometimes that's the only thing that will touch chronic pain. We don't know. So I'm a little more left of center when it comes to the ways today to manage chronic pain when nothing else is managing it. Now, do I advocate it? And the motivation behind it is I'm just going to get effing high? No, that's not the motivation we're looking for. We're looking to get better, to feel somewhat normal, to not have to deal with chronic pain all the time. And I'm not advocating it one way or the other. I'm saying that happens to be one way that people do manage their pain. In our rooms, there are others that call it California sobriety, which is different. And I'm not sure what you think about that, Heather. I know I have some thoughts around it.
Cali sober, they call it.
Exactly.
So I'm Cali sober. I was in San Diego last year, And I went to a meeting and I heard that was the first time I ever heard those words before. I was Cali sober. 2 women shared about this in this meeting.
Right.
And I was like, what's Cali sober? And then they explained that Cali sobers, they don't drink alcohol, but they use weed, use pot. But these 2 women didn't come in to share that was a great thing. They came to share that brought them back to drinking.
Yep.
And I sat up on that one. I listened to that really big time because I was like, wow, because they thought, no big deal. They're sober. They've been sober for many years, double digits. And this edibles are legal. And just a little bit of an edible here and there, help me sleep better. There are some medications that they do prescribe for people with addictions that are like non-addictive that try to help
Right.
downregulate
The
anxiety.
CBD and yeah.
And the Buse Spar and different ones like that. But then micro dosing tiny bits of marijuana is what they both said they did until it became a little bit more and a little bit more and a little bit more. And then it began in the morning, and then it began in the noon, and then at night, and then it began, and then they lost friends, and it just turned into a full blown problem. But I think what I'd like to say is that I get a feeling that, there's a lot of evolution here around medications, right? I have a feeling back in the day, many years ago, when we were getting people off of alcohol, that doctors probably did use tranquilizers and Valium and things like that because they were so anxious and they couldn't sleep. They weren't really treating the root cause. We didn't have the kind of science behind what a lot of these great drugs do now, and they really work with the brain. And there's hot spots in the brain, and they help to. And I was told that these are hot spots and it causes imbalances, and so these medications can bring cooling and moisture back in the areas of the brain. And it's very much a part of recovery when you are monitored by a professional doctor and you are not your own doctor. And I want to just say this because I think this is the real core focus. The goal is not to numb. If I'm going to take a medication and my thinking is, I just want to numb, then I am going into my addictive part, okay? The goal is to use this medication to create enough safety in my body to heal. Those 5 years of being anxious and not sleeping, I wasn't really healing. I wasn't getting better. If anything, I was getting more angry, more frustrated, and I didn't know how much longer I was not going to be able to drink. Because I didn't know how to self-soothe. But once I started those medications, then I was able to work with the therapist and work on the trauma and not injure myself, telling the story over and over again, and not rupturing my safety, but being able to do it with the help of the medication and the therapist. I was able to go deeper and really do a lot, make a more coherent narrative of what happened to me. And as time went on, I started to feel calmer. I felt safer. I didn't have the anxiety, and I started to feel like I was ready to start to taper off. And I did, but I didn't do it on my own. I always tell people, never quit your meds without help. You need to titrate, and you need to go, maybe perhaps with me, with the sleep meds, I needed to go to another sleep med. And I did that for a year. And then I went to another sleep med. It was a long process, but I did it right. Because if I'm not going to do it right, I'm going to be right back to that jittery, anxious self that wants something to feel better immediately, right?
Right.
So I also had brought into my recovery yoga tools. I was learning breath work. I was learning how to ground. I was learning how to pause. So I was practicing a more responsive way to the world. So I was doing a lot of different work, and combined with the medication and the meetings and all the different things I was doing, I did feel I got to that point where I could let go of it and find that balance, and it worked. Now, I'm saying is that my goal to get off medication? No, my goal was to feel safe in my body. If it meant being on medication for the rest of my life to feel safe in my body, I would do that. I have seen people make the mistake of going off medications that they really do need, might for the rest of their life, because, folks, we injured our brains. We injured our brains big time. I hate to say brain damage, but yes. And sometimes we need that extra support of medication for the rest
Right.
of our life. And that's okay. It's not a moral failing that I need medication. And they go hand in hand. And that's what we've got to just keep reminding ourselves, that this is important. They go hand in hand. Recovery with medication goes hand in hand. It's
Yeah,
not one or the other. And the stigma must end.
it does.
And I imagine that's what you were talking about at your
And we're all entitled to our positions and our opinions. It's like when we start pushing them on other people, though, that's an issue. And when it comes to people with legitimate problems that are shamed and basically told they're not really sober, does harm. Medication-assisted recovery is still recovery, and sometimes without it, the recovery can't progress, as you just noted. It can't progress because you're trying to manage the anxiety or the depression or the PTSD or the bipolar. And it's like, we can only handle so much at one time. And so medication-assisted recovery is still recovery, as I see it. And it's all about making sure it's getting managed by a doctor, that you're taking it as prescribed. What is the motivation behind having to take this medication? It's a legitimate medical or mental health issue, right?
It really is. And you said something just a little while ago, and I want to pop that back out. When I had gallbladder surgery, I remember my mentor said to me, listen to me, you are going to get pain management. You
Mhm,
will not heal if you are in pain. We
mhm,
can't, the body will only heal in parasympathetic rest.
mhm.
Okay. We need to be out of that fight flight thing and in pain. So we need to take our pain management. And I hear a lot of people, I've heard people through the years, oh, I didn't take my pain management, and they had major surgery. And I'm like, wow,
Oh,
how long did it take you to heal? I mean, I'm not impressed. But like you said, having management, having somebody maybe monitor how much you're taking and this and that. I will say this, it's getting into a little bit of a tricky area with all this, the buzzword of microdosing. I'm hearing more and more people with long-term sobriety going off and going with professionals, doing psilocybin treatment, doing ketamine treatment, doing and working with professionals. I'm just putting that there because what ends up happening is there's a lot of treatment resistant mental illnesses, depression, and suicidal ideology, SI. Those are things that need sometimes outside of the box help.
uh-huh.
Okay. And I want to just share this because I've listened to big speakers talk about this, big recovery people talk about it. And there was one in particular, yogi man, Tommy Rosen, that talked about this. And I was profoundly affected by what he said. And I just want to kind of share what he said because I thought, he said, you're gonna hear this. You're gonna hear people in the rooms. They're gonna be looking for outside help in different ways, and you're not gonna agree with it. You might not
Huh.
be think, oh, wow, they're sober and they're doing ketamine infusions, and I don't want to have anything to do with them because in my mind they're using. Okay, but what
Mhm,
if that ketamine infusion that they're doing, facilitated with a therapist, all the right ways, is a breakthrough and a saving their life, right? And what if that person is doing psilocybin and they've had just long-term SI and now it's gone? I mean, and he said, we'll be here waiting for you. If you don't feel comfortable coming back to the room or coming back to the community, we'll still be loving you and our hands out here for you, and but he said, the reason I share this is because I would have given anything. I think it was his cousin or maybe his niece that committed suicide. And if she could have had one of these things
uh-huh.
to saved her life, and that's what he said. If it saves their life, then who am I to judge whether or not they're sober or not? And so I'm just putting that out there as a little bit of something to think about because we talk a lot about we want to have tolerance, we want to have courtesy. We know that everybody's suffering from growing pains, everybody's suffering from their hurts. But who am I to judge whether you are sober or not and that you can't be here in our community? I mean, no, everyone is welcome. But we are turning the corner into a whole mystery area. Maybe perhaps like the people back in the day were in that mystery area of antidepressants and the pills that were coming out. Now we've taken a whole nother turn.
Right.
And, and how are we going to address this, Peg? And are we going to just be love for people?
And without judgment. And this disease is a lonely disease. Just alcoholism alone is lonely. And then when we're stigmatized because we've needed to get on medication for a dual recovery issue, it just layers on more loneliness. And who are we to judge what one human needs to be able to live a full, satisfying, and sober life? I don't know that if I hadn't treated my own depression with the help of my therapist and a doctor, I don't know. I don't think I would have been able to maintain my recovery, And so I think that's important to keep in mind. And it's also really helpful to work with therapists and psychiatrists and doctors that understand the recovery process and understand the process that we go to get and stay sober, and that they understand our program. So the bottom line is we need to treat the whole person. We're very complex, multi-layered, loving, wonderful human beings. And we happen to have the disease of alcoholism. And we're also, in many cases, diagnosed with other issues that, whether we drank because of those issues or whether those issues came up as a result of drinking, doesn't really matter. The fact is, it is what it is. To treat the whole person and not just the addiction and not just a diagnosis. Both things are real and both things deserve care.
And I'd like to was just saying this, if you are someone who's navigating dual recovery, you're not doing it wrong if you need support, okay? Whether that's therapy, medication, yoga, 12 steps, just like you said, Peg, it's about healing your whole self. And the truth is, healing doesn't happen in shame. It happens in safety.
It does. And it's up to us, especially those of us that have some time and are blessed with time, to really cultivate that sense of safety and that sense of not judgment, no judgment here. It's like how people, what their sobriety journey looks like is their journey. And this can be complicated. It can get into a gray area. I think it's important, especially around the California sobriety. That is a whole different issue, right? That's different because that is the goal of changing our state, our mood. And when I got on antidepressants, it didn't change my state. It helped me to feel more balanced, but I wasn't high. I wasn't numb. I wasn't removed from reality. If anything, I felt more in touch with reality. And I was able to continue on with my recovery to this day because of the help that I received, outside help and the outside medication. But I always have to look at my own motivation. And it's about, do I want to get better or do I want to get effed up? And I don't want to get effed up. I want to stay sober. It's a beautiful gift. And I'm grateful for it. And I don't think that we're here to judge each other. I really don't. So with that said, thank you for joining us on this episode of Recovery the Whole Enchilada. And if you connected with today's episode, please share it and like it and subscribe wherever you listen to podcasts. Your feedback helps Heather and I to shape future conversations. We love you, and remember that your recovery story, with all its flavors, textures, and complexities, matters deeply. And until next time, stay strong and keep growing. Love you.